Hey everyone, ever think about how something you can even see can completely change the world? We're talking about viruses. Tiny little guys or girls that aren't even technically alive on their own. They're like microscopic hitchhikers needing a ride inside a living cell to survive and multiply. So how does these tiny travelers get around? So let's explore the invisible highways they use to spread. So first up is the airborne transmission. Think of a sneeze, a tiny explosion of virus carrying droplets. Flu, COVID 19, even the common cold, they all travel this way. Some smaller droplets called aerosols can hang in the air for surprising amount of time, especially in poorly ventilated spaces like crowded buses or poorly ventilated classrooms. Next is the direct contact. This is as simple as it sounds. Touching an infected person, a handshake, a hug, even a kiss can spread viruses like herpes or HPV. And let's not forget our animal friends. A bite from a rabid dog or a scratch from a cat can be a serious problem. Then there are contaminated surfaces, what scientists call fomites. Your phone, your keyboard, that door you just touched, these are all potential virus hotspots. Norovirus, for example, is a notorious surface dweller, surviving for hours, even days, just waiting for its next victim. That's why washing your hands is so important. It's like cutting up the virus highway.
Okay, so we covered the basics, but viruses are sneaky. They have more tricks up their sleeves. Bodily fluids are another major highway. Blood, semen, vaginal fluids, these can carry viruses like HIV, hepatitis B, and C. Unprotected sex, sharing needles, even unscreened blood transfusions, these can all lead to transmission. Then there are vectors like living carriers like mosquito and ticks. These guys don't get sick, but they can spread viruses like Zika, dengue fever, Lyme disease, and West Nile virus. Think of them as tiny, six-leg delivery services for viruses. Contaminated food and water are another big one, especially in areas with poor sanitation. Hepatitis A, for example, can spread through contaminated food or water. This is why safe food handling and access to clean water are so crucial. And finally, some viruses don't even wait until birth. Through transplacental transmission, viruses can pass from a mother to her baby during pregnancy. Zika virus and cytomegalovirus are examples. These infections can have serious consequences for the baby. So viruses are small, but they're clever. They use every possible route to spread. But the good news is we can outsmart them by washing our hands, practicing safe sex, cleaning surface, getting vaccinated. These are all simple actions. They can make a huge difference. Let's learn to navigate these invisible highways safely and protect ourselves and our communities. Thank you.
Today, we will discuss common and emerging viral infections that affect people around the world. Some well-known examples like influenza, COVID-19, hepatitis B, HIV, dengue, and rabies. These viruses can spread easily and can cause serious health issues. Understanding them is important for our health and safety. Let's start with influenza. This virus infects our nose, throat, and lungs. It is very contagious and can spread from person to person. Influenza symptoms can range from mild like a runny nose to severe causing high fever and difficulty breathing. Each year many people get the flu but vaccines can help prevent it. Next we have COVID-19, one of the deadliest virus infection, which has impacted our lives significantly. This virus can cause severe respiratory illness and has led to many hospitalizations and death. It spreads easily in crowded places. Vaccines have been developed to help protect people from COVID-19 and they have saved many lives. Another important virus is hepatitis B. This virus affects the liver and can cause long-term health problems. It can be spread through contact with infected blood or body fluids. HIV is another virus that attacks the immune system. but with proper treatment, people can live long and healthy lives. Then there's dengue, which is spread by mosquitoes and can cause high fever and severe pain. Finally, we have rabies. It's a deadly virus often found in animals and requires immediate treatment if exposed.
Nurses and healthcare professionals are essential in stopping the spread of viruses and caring for those affected. One of their main responsibilities is educating individuals and communities on how to prevent infection, such as encouraging frequent hand washing, proper mask use during outbreaks, and staying up to date with vaccinations. By leading health education efforts, nurses help raise awareness and reduce the risk of viral transmission, especially among vulnerable groups.
Within healthcare settings, nurses are often the first to notice early symptoms of viral infection due to their constant interaction with patients. This allows them to act quickly by reporting cases, insulating infected individuals, and following infection control guidelines. Measures like wearing protective gear, disinfecting surface, and limiting visitation are crucial practices nurses enforce to contain spread of infection within hospital and clinics.
When it comes to treatment, nurses play a hands on role in managing viral illnesses. They assist in administering antiviral medications, monitor patients' progress, and provide care to relieve symptoms. In more serious viral outbreaks like COVID-19, nurses help coordinate care among different departments and serve as a comforting presence for patients dealing with stress or fear during isolation.
In summary, nurses and healthcare workers are gateways in both preventing and treating viral infection. Their ability to educate, identity, and manage infection not only improves the health of an individual patient but also supports the broader healthcare system. As new viral threats emerge, their will continue to be vital in maintaining public health and safety.